Welcome to Diseases of History, and today we're talking typhus. Now, typhus is technically three diseases, each caused by a different bacteria, each spread by different hosts, so I guess I'm cheating a little bit, but I make the rules here. But typhus are all what are called rickettsial bacteria, which means that they're tiny and live inside of a cell. They are all spread by different arthropod vectors. So, scrub typhus, caused by the bacteria Orienta tutsugamushi, is spread by the berry bugs, also known as chiggers. Those are those tiny little red arachnids that are kind of related to ticks. Murine typhus is spread by fleas which feed on rats and mice. The bacteria is called Rickettsia typhi. And then there's Rickettsia prowazekii, the epidemic typhus, which is spread by body lice. Now, this is the most severe typhus and the one that's most often seen in history, so it's what we'll focus on most today. Typhoid is totally different. It's a specific strain of salmonella, thanks medicine. And that's because typhus comes from the Greek word typhos, meaning hazy or smoky, which refers to the delusions brought on by the fever. So typhus typically starts with a sudden fever and flu-like symptoms for about a week or so after infection, and then a rash appears on the trunk and spreads outwards. Now, this rash typically spares the face, palms, and soles. Untreated typhus typically leads to meningoencephalitis, light sensitivity, delirium, and coma. Now, the first reliable description of epidemic typhus comes from the Spanish siege of Baza during the War of Grenada. So, 1849, people developed fever, red spots, delirium, and sores. The Spanish army actually lost over 5 times as many troops to typhus than they did to the actual war. There are some older descriptions that may be typhus, like the Plague of Athens in 429 BCE. We will talk about that one later. There was also an outbreak in an abbey in Italy in 1083 CE, and it's popped up at times of military conflict and famine throughout history. So famously during Napoleon's failed invasion of Moscow, in Ireland during the year without a summer following the eruption of Mount Tambora, again during the Irish Great Famine of 1847, during the American Civil War, and so on. And it's often associated with densely packed, crowded conditions. So it picked up the name jail fever in the Middle Ages because prisoners were often forced together in dark, filthy rooms. It became associated with poverty and urbanization. And an outbreak in Silesia in 1847 was what would lead a young Rudolf Virchow to become engaged in social medicine. Again, something we'll talk about later on in that 1848 series. But today I want to focus on that name, Rickettsia. Rickettsia comes from a man named Howard Taylor Ricketts. He was an American pathologist. Ricketts was born in Findlay, Ohio in 1871. He attended Northwestern University in Chicago for medical school and became interested in studying infectious diseases. Now, as we talked about last year for the National History Day special, the state of pathology at the time was largely focused on infectious disease, and pathology and bacteriology were often merged together into the same department because of major developments in germ theory in the late 1800s and the emergence of Koch's postulates. In 1900, Ricketts was initially studying the fungus blastomyces, which causes blastomycosis. That's a severe fungal infection native to the Midwest. And he did develop some rather unorthodox methods for studying diseases, including injecting himself with various pathogens to study their effects. Nonetheless, he rose to prominence and was offered a teaching position in the Department of Pathology and Bacteriology at the University of Chicago in 1901. However, at the same time, he also got an offer to study at the Pasteur Institute in Paris. So he took a year off to study infectious disease in Paris before returning to Chicago in 1902 to claim that teaching role. In 1906, Ricketts was sent to Montana to study Rocky Mountain spotted fever. And so in addition to setting up a university-style lab in Montana, he also conducted field research. So he would speak with victims of the disease, he would study affected animals, he would basically try to trace disease transmission. And this led him to the discovery that the disease is spread by ticks in the genus Dermacenter. And he was able to identify a gram-negative bacillus bacteria in association with Rocky Mountain spotted fever. Years later, Emil Brumpt would describe this bacteria and name it Rickettsia rickettsii in honor of Howard Ricketts. He also developed a guinea pig method to confirm that transmission was by these Dermacenter ticks. Now, that's all fine and dandy, but none of this is typhus. Following his time in Montana, Ricketts returned to Chicago to go back to his teaching position. Until in 1909, there was an outbreak of typhus in Mexico City. And because he was a leading American infectious disease expert at the time, Ricketts went to Mexico City to assist and to study the outbreak. So he approached his investigation in a similar manner, speaking with victims of the disease, setting up a bacteriology lab, and in his studies he became convinced that he was dealing with a really similar organism to Rocky Mountain spotted fever. It had very similar symptoms. And so he isolated the bacterial organism that caused typhus and found that it was a similar organism to that responsible for Rocky Mountain spotted fever. And in 1910, Ricketts argued that typhus was spread by some sort of insect vector, although he never identified the organism. Because just a few days after he isolated the bacteria, Ricketts himself contracted typhus and passed away. A few years later, his wife established a memorial endowment with the University of Chicago to fund students researching pathology and biology, and some of his colleagues established a memorial laboratory in his name. Now, unknown to Ricketts, at the same time, there was a French surgeon studying a typhus outbreak in Tunisia. So this is Charles Jules-Henri Nicole, and he's employed by the Pasteur Institute in Tunisia. And he actually employed many of the same techniques that Ricketts did. He was struck by the distribution and seasonality of the Tunisian typhus outbreaks. It mainly hit armies during war, it hit prisoners, and it hit displaced populations during natural disasters. It also tended to strike more during the cooler months. And Nicole was particularly interested in transmission in hospital waiting rooms. See, at the time during an outbreak, up to a third of doctors would get exposed to typhus from their patients. In these crowded waiting rooms, typhus patients would spread disease to staff and to other patients. But then once they were admitted, they didn't seem to be a risk to others anymore, aside from the folks who handled their possessions. So Nicole thought it was a bit discordant that this disease is at the same time so contagious that you can get it from their clothes, but not so contagious that you can get it from the person after they've been admitted. And so he theorized that it's actually the body lice on the clothing that are the source of the typhus. And so to test this hypothesis, he exposed macaques to typhus from the blood of an infected patient. Those monkeys then developed typhus, and so he transferred lice from them to uninfected macaques. The new macaques developed the disease, and therefore lice are the vector. He then went on to develop his own guinea pig model, and in the guinea pig model he showed that it's not actually the louse bites that are the source, but rather louse feces that are inoculated into wounds by scratching. Identification of a vector allowed for control of its spread, so during World War I, at-risk populations were actually treated with acaricides to reduce the spread of typhus, which saved a lot of lives. Although it did end up leading to widespread use of DDT, that's a story for a later day. Nicole was awarded the Nobel Prize in Medicine in 1928 for his discovery.